So we have much to learn about tinnitus, but now we know so much more than we did before. It appears that the top 4 tinnitus troublemakers are maladapted brain circuitry in the auditory cortex, maladapted brain stem circuitry, that's number 2. Number 3, trigger points in the head, jaw, neck, and or the shoulder complex. Number 4, poor sleep and stress. If we had to simplify it even more, we could say that tinnitus is from hearing damage resulting in brain maladaptation or stress causing trigger points. So that may not sound very simple, but that's brain maladaptation or stress causing trigger points. Of course, this is incomplete and oversimplified, but with this information we can help you with what we know and build on that as we get smarter. So in this video, I'll share with you the approach for effective treatment of the trigger points and causes of tinnitus, as well as headaches. This approach is adapted from the tested and published method presented by Dr. Tichy in the International Tinnitus Journal in 2012, who said of muscle trigger point treatment, the only certain way to determine whether trigger point treatment will be a benefit for tinnitus is to carry out a therapeutic trial. Basically, try it, see if it works. In his research, people were treated by trained professionals, but if you follow my directions carefully, you may find this quite effective for yourself. I would expect even better results if you do get the assistance of a professional like a massage or a physical therapist or a chiropractor. So in the jaw muscle category, we have the masseter here, the temporalis, and the pterygoid muscles, which are inside. The neck extension muscles, those that bring the head back or hold it up. So we spend a lot of time in this head forward posture. So what are these muscles? The levator scapula, the splenius capitis, and the upper trapezius. And finally, the neck flexion muscle and rotation muscle, the sternocleidomastoid. So these are the top 7 tinnitus troublemakers as it relates to muscles. Treatment and prevention of trigger points of tinnitus and headaches. So what are the methods? So 2 basic methods. We've got habits to avoid and therapy to do. So habits to avoid and relieve trigger points of tinnitus. So these habits involve posture and movement, relaxation, stretching, and sometimes oral splints, those little mouthpieces of bite guards. These habits are critical for your recovery and to prevent your trigger points from returning immediately. These were taught and practiced by the participants of the research who successfully reduced and eliminated their tinnitus. So please learn and practice these diligently. Your success depends upon this. And number 2, the therapy. Therapy to remove tinnitus or trigger points of tinnitus. The therapy involves using your hands to basically squish out the toxins, which are the built-up waste products, out of the muscle and into the blood where they can be removed from the body. So what are the habits? Well, to avoid and relieve trigger points of tinnitus, what do? So a couple of habits, posture and movement. So what is the correct posture for sitting at your desk for 8 hours a day? Do you know? What does it look like? Well, I'll give you a hint. This is a trick question. There is no correct posture for sitting 8 hours a day. No one should be sitting all day long without getting up regularly. So former NASA health researcher Joan Vernikos, she was PhD, in her short, insightful book called Sitting Kills, Moving Heals, shares how the ill effects of weightlessness, which people have when they're in space, called gravity deprivation syndrome, can be reproduced here on Earth by not moving enough. So, habit number 1, do not sit longer than 20 minutes without standing up. Stand up and squat down, touch the floor if you can, stand up again, reach to the ceiling, and squeeze your elbows toward each other behind your back, down low, and squeeze them again together in front. Then squeeze your elbows together toward each other behind your back, up high at shoulder level. Repeat that 3 times and do it again every 20 minutes. When you're sitting, which we all do so much of these days, you need to sit in a way that maximizes blood flow through your muscles. So remember, trigger points are a buildup of waste products that haven't been cleaned out by blood flow. Whether it's typing on a computer, reading a book, phone, tablet, or doing other work, with your hands for long periods. You hold your head and neck, shoulders, arms, and back in a way that minimizes muscle tension. This is what we want to do. Tension is great during exercise, where you contract and relax muscles, stressing them, straining them, and pushing blood in and out. When there's tension that is sustained, where there's no relaxation, we may think we're relaxed when we're sitting, reading, or writing, or typing, but if our posture is not quite right, there's a little bit of stress on that muscle. So during that time, the waste products of muscle activity cannot get out because the blood vessels are compressed. Or if we're just sitting, we're sitting on those muscles and those blood vessels, and so the blood flow in our legs is reduced, especially in our gluteal and hamstring muscles. So this is even true with slight muscle tension as seen in poor posture or poor ergonomics at a desk, over a phone or a tablet, or while driving. So here are the keys to remember for posture that you stay in longer than 5 minutes. The center of your head should be directly over the center of your shoulders and the center of your hips. So as seen from the side. So this way. So head not forward, but over the center of your shoulders and directly over the center of your hips. So not leaning forward from the head, from the neck, or the lower back. And the line between the center of your ear and your eyes should be angled slightly up or horizontal so that you are looking straight forward or slightly downward. So what does that mean? The line between the center of your ear and your eye. Okay? So why do I make it so complicated? Just look straight forward, right? Well, if you're laying down, it's okay to lounge back, but this principle can apply when you're reading a book or when you're working on a phone or a tablet. But if you're just sitting at a desk, then of course you want the screen up at eye level and just be looking straight forward. So elbows directly below your shoulders, right next to your side. So again, if you're typing or writing, or not so much writing, if you're typing or on a keyboard, or you're mousing, or you are texting or something like that, elbows directly below your shoulders, so relax them straight down, and right next to your side. Elbows bent at 90 degrees or slightly straighter. And don't forget habit number 1, which is don't sit longer than 20 minutes without standing up. Habit number 2, hold your head and neck, shoulders, arms, and back in a way that minimizes muscle tension. All right? Here are the keys to remember for movement throughout your day and week. Habit number 3, exercise regularly. What you train your body to do regularly is what it will become most efficient at doing. So if you spend most of your day sitting, how can you expect to be able to play a sport with your friends occasionally without injury, or get up and down off the floor with the grandkids? At the very least, go for a brisk walk 3 to 5 times per week for 30 minutes. Take the stairs when you can, and do things that are a little less convenient if it allows you some extra exercise. And that covers moving your legs, but for good health, your body needs some extra challenge. I recommend the book or DVD called The Slow Burn Fitness Revolution. They have an exercise program that's safe for almost everybody, and it really does engage all the muscles. Relaxation. So our next principle, next habit. Tight muscles of the head, jaw, neck, and shoulders are almost always related to stress. You can undo all the effects of good posture by skipping this step. We express nonverbal emotion with our head, jaw, neck, and shoulder. Right? That's great. But if we have sustained mental or emotional state, the muscles stay tight. In much the same way poor posture causes muscle tension. This stress compresses blood vessels of the muscles and causes the buildup of waste products in the muscles. I've included 2 age-old techniques that have been proven powerfully effective for relaxing the mind and the body. The first one is progressive relaxation. The second is diaphragm breathing. So the short version of progressive relaxation is this. Fully contract each muscle of your body. Be as selective as possible in contracting only individual muscles. So start down at your toes, but do the left and right at the same time. After fully contracted, breathe out and fully relax the muscle. Progress through the whole body, from the toe to the trunk, from the fingers to the head and the face. Diaphragm breathing. Breathe in and out very slowly. You'll take approximately 4 to 6 seconds to breathe in through your nose and 12 seconds to slowly breathe air out through your mouth. So 4 to 6 seconds to breathe in and 8 to 12 seconds to slowly release the air out of your mouth. Habit number 4, fully relax occasionally throughout the day, even if for 60 seconds at a time, and for 15 to 30 minutes before you sleep. Why before you sleep? Well, because most people are not, well, a lot of people, especially if they have TMJ problems or tinnitus, they are not relaxed before they go to sleep. So this will help. Third habit, stretching. A jaw opening on track. So habit number 5, carefully stretch your jaw and neck occasionally, at least 2 times throughout the day. The jaw stretch. Place the tip of your tongue at the top of your mouth, directly behind your front center teeth. Okay? Slowly open your mouth, keeping your tongue in place. Open as wide as you can without pain or popping. So it looks like this. All right, next, neck contraction stretch. Forward, backward. Start with your head tilted all the way forward. Resist movement as you tilt your head back to look straight up. So do this with me. It's best not to push at the end of these movements. Repeat as you go forward with your hands on your forehead. Repeat 2 or more times. So start here. All the way back. Hands on your forehead. Just a gentle push. Okay, repeat that 2 more times. Then rotation with your hands on the side of your head. Start by turning all the way to one side. Resist turning all the way to the other side. Repeat back to the other side. Repeat 2 more times to each side. So look all the way to one side. So not your hand on your jaw, but the side of your head. And finally side to side. Start with your head tilted all the way to one side and resist movement to the opposite side. You may add a gentle push at the end if it doesn't hurt. Repeat back to the other side. Repeat 2 more times to each side. All right, in the next habit, sometimes oral splints. If you wake with much jaw tension, you need to be very disciplined at doing habits number 1 through 5. If you continue to have jaw tension, jaw pain, headache, or increased tinnitus when you wake up in the morning, you may benefit from an oral splint. You can find these online to purchase yourself, but if you want to be certain you have the right device for your mouth, a dentist can provide you with that expertise. That concludes the habits. I'll review them quickly. Habit number 1, do not sit longer than 20 minutes without standing up. Habit number 2, hold your head, neck, shoulders, arms, and back in a way that minimizes muscle tension. Habit number 3, exercise regularly. Habit number 4, fully relax occasionally throughout the day, even if for 60 seconds at a time and for 15 to 30 minutes before you sleep. Habit number 5, carefully stretch your jaw and neck occasionally, at least 2 times throughout the day. All right, so take these seriously. These are important as part of reducing tinnitus if you have trigger points in your neck, jaw, shoulders that are contributing to that. Thanks. Have a wonderful day.